All right, so thank you for those tallies. Meanwhile, back here on the local front, the Prime Minister has made note of our current COVID-19 trend, and I have Choi Min-jung in the studio with details on that. Min-jung, welcome.
Thank you for having me, Sunny.
Right then, let's begin with his remarks.
Well, Prime Minister Kim Boo-kyum said the country's outbreak is now on a downward trend after reaching its peak. He also thanked the public for their cooperation and their perseverance at such a challenging time. Despite the falling number of infections, however, Kim reminded everyone that we must remain vigilant. Let's take a listen.
People are letting their guards down, knowing that the Omicron variant has a low fatality rate. However, if you look at the figures, deaths are currently concentrated among the elderly. Taking this into account, Omicron still poses a grave threat.
The government has come under fire recently for the rising number of hospitalizations and deaths, as even today, like Soa mentioned, the number of people in critical condition has touched a record high. The Prime Minister offered his apology regarding this matter and said the government will take the criticism seriously. But he also reassured the public that thanks to their efforts, Korea's fatality rate is much lower than that of other countries with a similar number of cases. Senior health official Son Young-rae also said that the number of severely ill patients is lower than initially forecast, which was 2,000 at most. Thanks to oral pills and Omicron's comparatively mild effects, officials have downgraded their projection to a maximum of 1,700 severe cases.
Right, and Min-jung, I hear COVID-19 infections among the elderly is on the rise, though.
That's right, Sunny. Currently, people aged 60 and above take up around 1 in 5 new infections. And last month, this age group accounted for around 10% of all infections, but now that figure has doubled. Health authorities say the elderly are becoming more vulnerable to infections as many of them got their booster shots more than 3 months ago, and the protection offered by that extra dose is starting to wane. And despite this, authorities are once again asking seniors to get their boosters if they haven't done so yet, saying they are still 97% effective in preventing severe illnesses.
On the treatment front, Min-jung, I hear we have more medical care options for at-home COVID-19 patients.
That's right, Sunny. Those in home recovery will have more access to in-person treatment starting this Wednesday. Local health centers, including traditional medicine clinics, can submit their applications to provide in-person treatment for COVID patients. Previously, outpatient treatment was mainly limited to medical centers specialized in respiratory diseases. Patients can now book an appointment for in-person treatment and are allowed to visit clinics and hospitals even if they're under self-isolation. However, people must take note that any drugs they need have to be picked up by someone who is not in quarantine.
Clinics and hospitals have separate appointment times and areas for COVID patients to prevent infected people and healthy people from being in the same area at the same time. However, it's very difficult to apply the same measures to pharmacies. So another person must pick up the medication instead of the patients themselves. And if this isn't possible, they can pay and have them delivered to their homes.
On the vaccination front, Min-jung, I understand inoculations for children are starting this week, right?
That's right, Sunny. Beginning Thursday, children aged 5 to 11 will be able to get their COVID-19 vaccines. Around 1,200 medical centers nationwide will be providing Pfizer shots for these children, and health authorities are strongly advising that minors at high risk, including children with obesity or weakened immune systems, get inoculated. The same recommendation applies to children who have previously contracted COVID-19 if they're at high risk, but not if they're healthy otherwise. Children in this age group will be given 2 shots at an interval of 8 weeks, and they must be accompanied by a legal guardian.
Min-jung, one final question before you go then. What's the fate of our social restrictions, which will come to an end on Sunday?
Well, officials appear to be weighing the option of easing our current restrictions. As of now, private gatherings are capped at 8 people, and most businesses must close by 11 p.m. The rules are set to expire on Sunday, and new measures will likely come into effect starting next week. The expected changes are likely to include a higher social gathering cap of 10 people from the current 8, and they're also likely to extend business hours to midnight. Authorities have said that now is the time to encourage people to take individual responsibility rather than imposing restrictions which they say are no longer effective. They also said that such rigorous curbs are unnecessary when considering Omicron's low fatality rate, currently at less than 1%. Officials, though, are well aware that cases may spike if restrictions are all eased at once and has hinted at a gradual process. The country's Pandemic Recovery Committee will meet on Thursday to discuss revisions, and authorities are scheduled to announce the new measures on Friday.
And I'm sure you'll update us as soon as that is done. All right, Min-jung, thank you for the latest on the local front. I'll see you back here on Thursday.
Thank you.